You've probably heard of immediate load dental implants, the one that promises fixed teeth on the very same day. But is it really possible, or is there a lot of marketing behind it? I'm Dr. Alessandro Barbosa, a dental implant specialist with over 20 years of experience. And today, I'm going to explain when this technique is truly safe and in which cases it can put the results at risk. And at the end, I'll show you what no one tells you about the actual time for osseointegration. The idea of immediate loading came from the desire to reduce the time between placing the implant and installing the tooth. In the past, a patient would get an implant and have to wait 3 to 6 months to receive a tooth on top of it. With the advancement of techniques and materials, it became possible in some cases to place a prosthesis on the same day the implant is installed without compromising the healing process. When we place a prosthesis on the same day or within the first 72 hours after the implant is placed, we call it immediate loading. Many people think that immediate loading means a ready and final tooth on the same day. But in reality, the term refers to placing a fixed temporary prosthesis right after the implant surgery. This is only possible if the implant achieves sufficient initial stability, what we call minimum torque, which is usually above 35 newtons. This stability is essential to ensure the implant doesn't experience micro movements during healing, because any movement can compromise its integration with the bone. In other words, success depends on the bone quality, the surgical technique, and the implant's position. It is a predictable technique, yes, but only when it's properly indicated and executed with care. Immediate loading represents a huge leap in comfort and self-esteem for the patient, who quickly has their function and aesthetics restored. Immediate loading is indicated in very carefully selected cases. Patients with good bone quality and adequate bone volume, the absence of infection in the area, proper digital planning with a surgical guide and a prior CT scan, and of course, when the implant achieves the necessary primary stability. For patients who have lost a lot of bone, who smoke, have uncontrolled systemic diseases, or active infections, the risk increases. Immediate loading can be indicated for single, partial, and full arch implants. However, in my clinic, my personal approach is to perform immediate loading mainly in full arch cases and in some partial cases. I don't usually perform immediate loading in single implant cases. What I always explain is that the success of the implant isn't about speed. It's about the planning and the perfect healing process. Sometimes waiting a few weeks is what ensures a long-lasting and stable result for many years. Unfortunately, the term immediate loading has become a marketing tool. Many people advertise fixed teeth on the same day, without making it clear that, in most cases, this tooth is temporary and must be replaced by the permanent one after the healing period. This creates a false expectation in the patient, who believes they are leaving with the final result. And the problem is that when haste wins over common sense, the risk of things going wrong increases. The implant may not osseointegrate, and the patient may need to do everything all over again. Therefore, it's essential to seek truthful information and a professional who explains each step with clarity. When properly indicated, immediate loading has many advantages. It provides much more comfort for the patient, avoids the use of temporary removable prostheses, reduces the number of appointments, and speeds up the aesthetic recovery. In other words, it's a fantastic technique as long as the patient understands that the osseointegration process still takes weeks and that the final result comes later. And this transparency is what differentiates a serious treatment from a miraculous promise. So to answer the question, is the immediate load implant a miracle or marketing? Neither a miracle nor marketing. It's science applied with responsibility. Immediate loading is a modern, safe, and highly effective technique, but it requires planning, experience, and well-defined criteria. True success lies in balancing the patient's desire with the biology of the human body. And as I always tell my patients, haste is the enemy of osseointegration. In the end, what matters most is a stable, beautiful, and long-lasting result. And that can only be achieved with technique and patience. If this video helped you better understand how immediate loading works, leave a like and share it with someone who is thinking about getting an implant. If you want to keep learning more about dentistry and implantology in a simple, safe way, subscribe to the channel and activate the bell so you don't miss any new content. I'm Dr. Alessandro Barbosa, and my mission is to simplify dentistry and help you make decisions with safety and information. See you in the next video.